Hi, I'm Dr. Aditi Garg and I'm a maxillofacial surgeon. I have around 15 years of experience and I practice at Elite Aesthetics and Dental Clinic in HSR, Bangalore. So we are going to talk about Botox and fillers today. They are both very different materials and they have a different indication. Now Botox is basically botulinum toxin. This acts by relaxing the muscle. Now normally the muscles have a junction which is called as a neuromuscular junction. The nerves get the stimulus and the muscles respond in a particular way. Now when these happen on the face, we see wrinkles and these are called as dynamic wrinkles. These wrinkles happen when we are moving. For example, when you are frowning, when we are smiling, and then we see these lines happening on the forehead or around the eyes, around the lip. Botox will help in this. Because Botox temporarily relaxes the muscles, when these Botox injections are placed around these areas, they act on this nerve and muscle junction and inhibit the movement of the muscles. The work of these Botox is temporarily. It works for around 6 to 12 months. And with repeated use, yes, the duration can be increased. Fillers on the other hand, as the name suggests, fills, which adds volumes. So fillers can be of different types like hyaluronic acid or hydroxyapatite or polylactic acid, which are the commonly used ones. These fillers will fill up the area where there is deficiency. Now with increasing age, these wrinkles, these lines, they become static. That is, even when you are not moving them, even when you are not smiling or frowning, these lines will stay. Fillers are used to fill these areas. Fillers can also augment some areas, change the shape of some areas, improve the hollowness. For example, it can improve the hollowness under your eyes. It can also change the shape of your lips, giving them a plumper and a more voluminous look. It can augment your chin, your lower jaw. So fillers is something which fills an area, it augments an area and it is helpful in static wrinkles, the wrinkles which are at rest. Whereas Botox is something which will help in dynamic wrinkles, the wrinkles which appear on movement. So when you are in your 30s and early 40s, Botox is something to start with. But if you reach in your 40s and 50s, then a combination of Botox and fillers might be needed, especially if you are talking about wrinkles. So if we talk specifically about deep wrinkles, in that a combination would be more advisable, because when deep wrinkles happen, there will be static lines as well as dynamic lines which are accentuated while you are talking or smiling or frowning. Botox is used to stop dynamic lines and fillers are used to stop static lines. So the choice of whether to go for Botox or whether to go for fillers depends on what is your indication, what is the area you want to improve. You will have to discuss your concerns with your treating doctor and then you can understand better what is rightly indicated for you. Sometimes a combination works the best. Use of Botox can reduce the amount of filler which is needed for you, and also it is a little area specific. So on your forehead, around your eyes, Botox is ideally preferred, but for the lower face like your chin, your lips, your under eyes, your nasolabial folds, filler is rightly indicated.